J. Coley Alston. The J is sometimes silent, so it's okay if you don't use it. I'm a Black transgender, non binary person born and raised in the Appalachian Mountains. I do have 10 years of experience postgraduate school and 12 years of experience working with Black, queer, trans, and systems involved youth. I completed my graduate and undergraduate studies at the University of Pittsburgh, and I actually recently received a certificate in LGBTQ affirming CBT training from Yale LGBTQ Mental Health Institute. So I'm really excited about that. And I did want to set the overall tone of this presentation with a quote from our queer ancestor, James Baldwin. Let's begin by saying that we are living through a very dangerous time. Everyone in this room is in one way or another aware of that. We are in a revolutionary situation, no matter how unpopular that word has become in this country. To any citizen of this country who figures himself as responsible, and particularly those of you who deal with the minds and hearts of young people, must be prepared to go for broke. Or, to put it another way, you must understand that in the attempt to correct so many generations of bad faith and cruelty, when it is operating not only in the classroom but in society, you will meet the most fantastic, the most brutal, the most determined resistance. There is no point in pretending that this won't happen. And I wanted to share that quote, and just knowing that even though this was written down in 1963, how applicable it still is in 2024. When we're currently seeing over 527 anti-LGBTQ bills introduced across the United States just this year, and 5 bills in particular that are being introduced to the House in Pennsylvania. So in order to fully dive into today's topic, I want to make sure we all are on the same page as far as definitions go. So I am going to be sharing a few definitions with you all. So when I mention or say transgender, I'm referring to a person whose gender identity differs from the sex that they were assigned at birth. When I'm using the term non-binary, non-binary refers to a gender identity that is not solely male or female. So this is someone who identifies outside of the gender binary. And if you're very confused or unfamiliar with the binary, binaries are things that are either this or that. So there's a gender binary, there's a racial binary, like that, this assumption that everyone is black or white. Binaries are archaic, totally incorrect, and unhelpful in connecting with each other as human beings. But some people are very much committed to them. We'll speak more about binaries and how they harm us in a few slides. And finally, gender nonconforming is denoting or relating to a person whose behavior or appearance does not conform to prevailing cultural and social expectations about what is appropriate to their gender. And one thing to note about gender nonconforming folks is that it is very specific to the culture that they're coming from and the culture that you're viewing them under. So sometimes there's just a disconnect there. So I did want to share this slide with you all as well. Really, it helps me to illustrate what I'm explaining. A lot of times throughout this presentation, I'm going to be mentioning transgender. And when I say transgender, I am including non-binary people. I am including other gender identities that are included. So when I say transgender, I mean trans men, trans women, non-binary folks, genderqueer people, gender fluid people, bigender, agender, neutral. Like there's so many genders. And I'm just going to be using transgender throughout most of this presentation, but I thought it was important to point that out. I also wanted to share, in case you're unfamiliar or just need a refresher, cisgender folks are under this gray umbrella over here. So cis is just a Greek prefix that means same. Trans is a Greek prefix that means different. If you are a cisgender person, that means the sex you were assigned at birth matches your gender identity. So if when you were born, the doctor said, it's a girl, and you're like, yeah, that's me, then that will make you a cisgender woman. I did want to share that and that this is not like a new thing as far as like naming. I will say it's pretty common, especially if you've taken organic chemistry or if you've studied molecular structures. Cis and trans are very common prefixes. Also, cis and trans are adjectives. So you always want to include the noun, just so so everyone's understanding that you're talking about human beings or if you're talking about something else. So if you're referring to a person and saying a trans, your statement is incorrect and incomplete. It would be like referring to a Black person as a Black. You want to make sure that you include the noun when you're sharing adjectives about people. So a trans person or transgender person would be correct and complete in that example. So once again, I'll be using mostly the term transgender throughout this presentation, but I did want to make sure you all knew that I was including non-binary people and other folks of a variety of genders underneath that umbrella as well. I think this is always important to share every time I'm presenting, and I do a lot of trainings like LGBTQ, awareness, history, inclusiveness, cultural competence type trainings. But a lot of times people are like, well, how many folks are there? And I do want to be very clear that the number of people that exist in the world does not does not imply that they are more or less valuable based on the quantity of folks that are present. I think that's really important to point out. So even though this number looks small, I do think it's very important that we still carry the same amount of respect and dignity for this group of folks, even if it's a small quantity. Similarly, Black people in the United States only make up about 13 or 14% of the population. We are no less worthy, no less important just because our percentage is not like the majority in numbers here, even though we do know that we are the global majority, being people of color, people of African experience. So about 1.4% of Black adults are transgender or non-binary, and that is that their gender is something other than the sex they were assigned at birth. Um, and I want to point out here that this is people who are identifying as trans or non-binary, and it does not include people who are perceived to be transgender or non-binary. Because again, the gender binary is rooted in colonialism and the notion of white supremacy. So even when African Americans subscribe to the idea of the gender binary, it was created to other us. It was not created for us. Um, so one of the things that it does is the gender binary categorizes people against their will, and it punishes those who do not fit into the arbitrary categories. So people who do not identify as transgender can still be at risk of ill treatment and health disparities. Cisgender people can be negatively impacted by transphobia. I need to make that very clear because if you're just going into this thinking like, oh, if I don't have that identity, I'm cool, I'm safe. Like, no, that's not what that means. So I want to be very clear about that and thoughtful in that regard. Once again, as we are going into our discussion around health disparities and what that looks like, the disparities are not rooted in identity. Health disparities are fueled by perception and treatment from other people and systems. Um, did I want to say one more thing? Ah, yes, had a little bit more to say here. Certain features. So in case any of this is difficult to understand as far as like the binary and how it hurts everyone, certain features have been categorized as masculine, for example. So someone who is taller, someone who has dark skin, someone who has a larger volume of fat or musculature, someone with a wider facial structure, better athletic ability. Those are all things that are considered masculine. Most of those things we have no control over. It's just kind of how we get categorized, and you can see like it's not really fair. Some individual examples of how that might look or show up in this world are Black women are often considered or portrayed as being masculine in comparison to non-Black women. So like Megan Thee Stallion and Taylor Swift are about the same height. Taylor Swift's actually an inch taller. But when you look at those two women, almost everyone comments on how masculine Megan Thee Stallion is. And it's just like they literally are about the same height, but because they're a different skin tone, because Megan Thee Stallion is a bit more curvy, she gets kind of pushed into that masculine aspect of the binary. And if that's unfamiliar, if you're like, I don't know who Megan Thee Stallion is, that's okay. Um, it's happened to other Black women as well. And these are all cisgender Black women. These are Black women who were assigned female at birth and identify as women. So Serena Williams, Sierra, Michelle Obama have also been subject to transphobic attacks, again, not based on their identity, but due to the gender binary, due to this assumption and this harm. So I just want to be very clear that the binary harms all of us, whether or not we realize it. And sometimes we are perpetuating harm through in using this gender binary. And those are very specific and individual examples. Right now, we're going to zoom out for a bit and look at disparate health on a population level, because that's what health disparities are all about, looking at populations. And though the findings and current state of Black transgender health are sobering, I will say this is very heavy. the fact that we have some data about this is really helpful. It helps us to understand where we're at and how we might implement solutions and some support, because historically, we have not had this information. Historically, we have been told over and over again, you do not exist, or too few of you exist, or you do not matter. And we all know that that is incorrect and untrue. I'm going to be going over some of these disparities. I'm going to go over each one of these, so I'm not going to read them out loud to you. But I did want to make sure, as we are looking at this, as we are understanding kind of like what's going on, the current state of Black transgender health, I don't want to get overwhelmed. I don't want to get to the point where we feel that we are helpless, that we are powerless, because that is absolutely not the case. So we have this information, and now we have a little bit of baseline data, so we know where to work from. We know where we started at this point in time, where we're at 2024, and we can now have aspirations and dreams and implement new plans and ways to change. So as you're listening to this, as you're participating, do not get overwhelmed. We are going to overcome all of this. So starting with unemployment, just because it's very, not, this is something that we all can kind of like interact with. Black transgender adults in the United States have doubled the unemployment rates of Black cisgender people in the United States. And we already know that unemployment for Black folks in general is much higher for non-white people, basically. So just trying to think and fathom that too, what that looks like if you are currently unemployed and how difficult it is to gain employment. It just sets you back greatly. Um, and when we're looking at poverty rates, 38% of Black transgender folks are living in poverty, or were living in poverty at this time, compared to 24% of Black people in the United States. I will say the current statistics that I'm sharing with you all are from 2015, which may seem like far or long ago, but that's still pretty good, pretty apt as far as applicability for right now. I will say though, so some people are like, well, can we get updated statistics? Can we get updated information? Absolutely, we can. But I will say it has not improved. Unfortunately, with COVID-19, a lot of these statistics have actually gotten more disparate. But I am sharing the most current information that I have access to. So just wanted to put that note in there. Um, yeah. So when you're thinking about that level of poverty, when you're thinking about that level of unemployment, also realize too that even access to certain social safety nets and social programs require that you are employed. They require, that you are, that you're actively working. So that's something else too to consider, that a lot of these folks don't even have access to those social safety nets. Police interaction is rough. Of course, I'm sorry. I'm hearing sirens as soon as I advance this slide. Police interaction with Black people in general has been horrible. And I do want to note that during a lot of the protests and uprisings in 2020, the main argument that was echoed was stop killing us. And instead of hearing that, the United States decided to make Juneteenth a holiday for everyone, including people that it doesn't apply to, and also gave more police funding each year since 2020. The police have gotten more funding than they ever have in years past. So instead of less funding, instead of divesting those funds into other social programs and supports, it's gone funneled more into police. It's gone funneling into cop cities, so that they can build fake cities to act out how they plan on killing us in the streets. And also, I will say it for us civilians, it's been deadlier each year since 2020 has. There's been a higher number of people being killed by police than ever before. Each year, beats the last year. So that's been very interesting. And of course, given that, you might understand why people would not feel comfortable asking police for help. This again is from 2015, so this is probably much higher now. And also to knowing that interactions that Black people have with police tend to be more lethal than how police treat other folks, people who are, non-white, but not Black as well. So uh this 21% of Black trans women facing incarceration at some point in their lifetimes is a ridiculously high number. Of course, not only that interaction with police, the likelihood of being physically or sexually assaulted, and also the likelihood of being placed in inappropriate carceral settings as well. So, for in a lot of states, Black trans women would be put or housed with cisgender men. And of course, being who they are and with their appearance, and that's wildly inappropriate, one, but two, it makes them a target of victimization within those spaces as well. Thinking about homelessness is, again, astounding numbers. 42% of Black transgender adults having experienced homelessness at some point in their lives, with 22% having experienced it in the past year. Um, in this day and time when we know that most folks are not making enough money to even afford a one-bedroom apartments in the states that they live in the cities that they live in, and also with the Supreme Court just recently criminalizing homelessness, it is very worrisome to see how this may increase in the future, in the near future. Also, another thing I want to note about homelessness in particular is there's not a lot of safety in shelters. So even in cities and states that don't have shelters just like overflowing with people, a lot of them are not welcoming to folks of trans experience. So that is something else to be aware of. I can speak on my particular city that I'm currently in, but it applies to the rest of the nation as well. Black people in general are overrepresented in the number of homeless folks in cities across the United States. So knowing that we're already more likely to be unhoused, and knowing that there's additional layers of oppression, it's something to be extremely mindful about. And even on the knowledge aspect, of course, something to consider, but I know a lot of people like to donate. So for organizations and shelters that say provide supplies to people who are unhoused, a lot of times they'll provide hygiene products, and and that's good. I'm not discouraging that. I'm saying that a lot of times people don't realize the number of folks who are unhoused who are Black and brown. So a lot of times the shampoos, conditioners, hair products even are just like wildly inappropriate for the actual population that's being served, but there's a big disconnect. A lot of people have this kind of like amorphous idea of what homelessness looks like versus like what it actually looks like in their cities. So again, just as another area to be thoughtful of, be mindful of. I mentioned a little bit around sexual violence, talking about police interaction, but just Black transgender adults are at a very high risk of victimization around sexual violence, whether it be from their immediate families, whether that be from people who are trying to inflict violence upon them in order to change their gender or their sexuality, and also violence from people who are embarrassed or ashamed of their attraction to transgender people. So it's something very scary to think about, especially considering the likelihood that you will be unable to contact police or to be treated with care or thoughtfulness if you do make that call. Um, so yeah, 53% of people being sexually assaulted at some point in their lifetime, with 13% in the last year. Um, And this is an example I'm about to share, not necessarily of sexual violence, but of medical neglect. Uh, I'm in my 30s, and I don't know if y'all can tell or not, but when I was a small child, I remember just not really paying heavy attention to the news, but seeing there's a woman, and now I know her name, Tyra Hunter. She was in a car accident in Washington, D.C. She was a hairstylist. And when EMTs arrived on the scene, and instead of providing her with life-saving service or transporting her to a hospital, they were laughing at her because she was a transgender woman and she did not have gender affirming like surgery. below the waist. So instead of helping her, they laughed at her. And actually, the coroner found that had they had they applied, medical response and gotten her care, she actually would have survived. So I think about that medical neglect, and I think about, people who are in a situation where they've experienced sexual violence. Who can you call, and who's going to help you? Because it would be terrifying to, experience that, and then the additional layer of not being helped and being laughed at and humiliated when you're asking the appropriate people for help and support. Um, Another area where there's just a huge health disparity for Black transgender adults is with HIV. About 6.7% were living with HIV, which is 20%, 20 times, sorry, the rate of the general population. It's just a huge disparity there. I will say even within that grouping, it's much less likely if you are Black and transgender that you are going to have access to antiretroviral medication. So less likely that you'll have treatment, less likely that you will be able to get your viral load to a place where you are undetectable. And if you are undetectable with HIV, that means you're unable to transmit it to other people, which is currently the public health goal. We want to make sure that people not only can live long, full lives with HIV, but also that we are able to slow the transmission or eliminate the transmission of the disease. And also, if you're Black and trans and HIV positive, you're much more likely to die due to complications around HIV. Again, whether that's just lack of medical access, whether that's lack of medication access, but also thinking about those other compounding things. If you are living in poverty, if you are unemployed, if you are homeless, it is very unlikely that you have a place to, keep your medication in a place that is safe and won't get destroyed. It's unlikely that you'll have enough food to even consume your medication. So thinking about how all of these things interact is hugely important too. It's not just kind of like um, little specks all over canvas. It's like a very blended painting if you're looking at this from that point of view. Um, and again, considering all of these things, all of these potentially negative interactions, especially on the social side of, being housed and employed and being able to live a life free from violence. Black transgender adults have experienced some very serious psychological distress. Thinking about like just surviving through the month is very difficult, but also right now in the current political climate, with all these anti-LGBTQ bills, I keep bringing up the bills because the purpose of those bills is really to eliminate transgender people from public life. It's not, again, this is a very small portion of the population. So why are our elected officials spending so much of their time and energy trying to eliminate a group of people? And also, why are we standing by and letting them do it? Why are we not speaking out about it, speaking out against it? Thinking about healthcare experiences as well. There's a lot to say about healthcare experiences, and I'm going to go into this, I think, in another slide or two. But we already know in the United States, Black people are treated disproportionately poorly with their healthcare providers, met with racism and already having to navigate that. So, in addition to racism, Black transgender folks have to combat transphobia and other forms of oppression and ignorance from their healthcare providers. If they have access. So, one of the things that I think is really interesting, and this is more from 2020 data, um, the likelihood that you're going to postpone or avoid getting preventative screenings if you're trans, particularly if you're a transgender person of color. In this particular study, they weren't able to separate out non-white racial groupings. So that's why it's transgender people of color, which unfortunately, due to our knowledge and our experience, we can conclude that Black transgender people are either going to have about that same experience or a little bit worse. Um, and also thinking about folks who have postponed or avoided necessary medical care because they couldn't afford it. Affordability is it's a huge barrier. Uh, for folks, whether, and whether you're Black or trans or not in the United States, unfortunately, our medical system is is repugnant. Um, so you're very likely to either not have the funds for it, or maybe you're already saddled with a large amount of medical debt and you don't want to add to that. Again, compounded if you are homeless, compounded if you are in poverty, compounded if you're unemployed or, not fully employed, as you should be. And then finally, on this, in this aspect, mistreatment. So this includes refusal of care, misgendering, verbal or physical abuse by a health provider in the past year. That's something that 68% of transgender people of color said they experience. So if, again, I compare it to the slide previously, it was in the 30s, back in 2015 and almost 70%, in 2020, as far as what that experience is like on the healthcare side for transgender people of color. Um, Also wanted to speak a little bit about gender affirming care because it's important and it comes up often. But uh, I'll say my piece after that I read the slide actually. So thinking about being denied gender affirming care. So imagine, that you have a provider, that you have, physical access, you have transportation to get to your provider, you have the funds for your copay, or, you have insurance. And imagine that you're getting denied care by your health insurer in the past year. And that's something that 56% of transgender people of color have experienced. Um, or imagine that, you know that you need gender affirming care, but you don't have, full insurance coverage. So, you know that it is unlikely to happen for you. Or that your health insurer refuses to update your name or your gender change on health records. So you've already gone through the process of legally changing your name or legally changing your gender marker, and now you have your health insurance that refuses to honor that and refuses to reflect that for you, um, to deny you care. I say this, and that I think it's important to point out and it's important to share. But I will say, and you'll see in a slide in advance, when I advance, it is so inaccessible, receiving any type of gender affirming medical care, especially for transgender people, especially for Black people. And notice I said gender affirming medical care for transgender people because cisgender people get medical gender affirming medical care all the time. And I'll give an example right now, actually. So a lot of people have been freaking out lately, talking about like, oh, people are getting these surgeries and, they're just giving them to children. It's just like there are no children just getting surgeries, especially not Black children, getting, surgeries and the medical care that they need. But in a recent review of 150 cases for gender affirming surgeries conducted on minors, people under the age of 18, they found that 146 of those kids, or 97% of them, were chest reduction surgeries for cisgender boys. So these are boys who were assigned male at birth, who are like, you know what, I got a lot of like extra tissue on my chest. It would make me feel better. It would make me feel more manly to have that removed. And they are able to receive their surgery versus folks who are potentially transmasculine and knowing how much it would improve their quality of life to receive that surgery, and knowing that they're going to be denied because they're minors, because they are trans. And it's just wildly upsetting, but also, of course, inappropriate and wrong and unfair. I will say too, I don't have a slide for this, but it's something that always sticks out to me. um, Black cisgender girls tend to encounter puberty much earlier than you would expect. I'm talking like 8, 9 years old, at a point where it would be devastating, even to a cisgender girl to have to navigate things like a period or body hair and things like that, when they're just elementary students. And it is possible for children to use puberty blockers. So basically, you can delay puberty until it is developmentally appropriate for a young person. And so many Black cisgender girls are denied puberty blockers or not even told that that's an option. They're just, again, told to suffer, told, to kind of like deal with that hurt and that isolation, when we literally have medical care that we offer to folks if you're not Black, if you're not trans. So it's very infuriating work. But also too, if you're not familiar with puberty blockers, they're very commonly used, again, to delay puberty for folks where, if they're hitting puberty too early, or in some cases when people are growing too much too fast, for someone's physical frame, puberty blockers, would make an excellent medical choice for someone. And these are blockers that are routinely denied to transgender young people to force them through a puberty that is not affirming at all to them. It's going to cause great distress to them mentally, psychologically, and it's going to be much more costly in the future to have to get medical um, affirming treatment in the future to undo the puberty that could have been delayed or blocked in the first place. And just again, I'm not sure everyone's familiarity as far as what gender affirming care looks like. I'm not going to like read this slide at you because it's a lot, but I really just wanted to stick to the four modalities of gender affirmation, because all of the major medical authorities know and support gender affirming care for transgender people, regardless, like whether they're a young person, whether an adult, because they know that it is life saving. Gender affirming medical care is life saving, absolutely. Um, and even though all of the uh, educational, medical, and institutional authorities know this to be true, know how important it is for folks, this states are still introducing legislation to prevent this life saving care, to criminalize this life saving care, even. Um, but the four modalities that I just wanted to share around gender affirmation, in case you're unfamiliar or in case you need a refresher, are legal aspects. And legal aspects include things like being able to have your legal documentation reflect the appropriate name and gender. So that's your birth certificate, your social security card, medical records, driver license, passport. If that doesn't match, it really limits your ability to move about freely in this country and beyond. Social modalities of gender affirmation are things that, you know, changing your name, your pronoun, your clothing, your style, how you express your gender. It is okay for a child at any age to participate in social gender affirming care and practices because all of those things are absolutely reversible. There's no harm. So when you hear information about like, oh, there's a transgender 6-year-old, it's like it's literally a 6-year-old who maybe has like a haircut and a name that makes them feel good. It's nothing that, we can't change in the future. It's not irreversible. So if a young person, if their identity is more fluid than we would anticipate, it's absolutely fine. And if their identity is not fluid and they are exactly who they already told you they are, then again, we all we did was provided help and care and support to a young person. So, oh no, we've provided support. Um, Other aspects of gender affirmation include medical things, and that's like I said, like the puberty blockers. It could be hormone replacement therapy, like testosterone or estrogen, things like that. But even other things that are considered gender affirmation are things like birth control. So if you've ever encountered someone who did not want to be pregnant and use birth control, that is an example of gender affirming care as well, and also surgical modalities too. Not that surgery is not important, it's just again thinking about Black transgender people in particular, since that is the topic at hand. We are so unlikely to be able to afford it, to have medical insurance that covers it, to have stability in our home situations, and that like we can take off work and be cared for by someone during the recovery period. It is just so unlikely. And not saying it's completely unattainable, but it's so uncommon, it's so rare. And I say that not to ignore it, but I say that and that it's something worth fighting for and worth supporting people about. Um, so I did want to pivot a little bit just to focus a bit more on youth. I know I've been talking a lot about Black transgender adults, but I will say it's important to talk about young people, one, because there's so many young people of trans experience and so many young people who do not have adequate support from the adults in their lives. And so since we are adults in this room, we can absolutely be that and be supportive. Um, So a lot of again, a lot of these bills are trying to stop young people from being able to access gender affirming medical care. And the claim is that this is to protect children and to assert parental control, but they all contradict evidence-based research on gender. The advice of leading medical associations show time and time again that this care is safe, it is essential, and it is life-saving. So all of these bills are basically like when they come up, when you see them, these are dead children bills is what they're advocating for. They're saying we want to make it so that your children feel that their life is not livable, like their life is not their own, and also that they have no hope in becoming and having their outward appearance match who they are. And I included this piece because I thought it was super interesting. So, this is a very specific research study around healthcare experiences for Black and Latina transgender youth. Latina being Latino, Latina, Latinx young people, only transgender young people. And I thought it was so interesting that Black non-binary youth in this data set were shown to be more likely than other groups to believe that their doctor understood transgender or gender diverse health issues. Like that trust is very different considering like all of that I've shared already with Black transgender adults, but also thinking about Black adults in general encountering medical systems. So I just am so interested and endeared toward that nugget of hope that these young non-binary young Black non-binary people have in their medical providers. And I think that's really cool. So something potentially to lean into as well. Um, but before we lean into that, I do want to talk about some other aspects for the Black transgender youth experience. And this is all data from Trevor Project. Trevor is a treasure trove, actually, of data if you're ever curious about young LGBTQ people, but especially if you're wanting to separate out, experiences based on race or experiences based on, sexuality different from gender. It's very cool information. So, um, but unfortunately, as you might have anticipated, uh, our Black transgender and non-binary young people, they are at higher risk of like negative health factors, unfortunately, and experiences of discrimination, even compared to Black cisgender, lesbian, gay, bisexual, queer folks. So this is just like groups that normally would just be like, all right, Black LGBTQ young people in one group, but we are able to separate out here and kind of look at what that difference is in their experiences. And it's still really high. Like, if you're cisgender Black young person and you felt that you've experienced discrimination around your sexual orientation, your gender identity, that's still really high. It's over, it's over half. And still, even higher when you're considering transgender young people. So just I'm not going to read each bar at you because you all can look at it, or if you can't see it, I'm happy to share my slides with you all after this. But thinking about just those very high rates of discrimination, um, being physically threatened or harmed due to their sexual orientation or gender identity, um, attempts by other people to try and change their sexual orientation or gender identity, and housing instability. And again, I think of this as really impactful because this is only Black youth that we're looking at right here, and just even seeing within our racial groups the kind of disparate experiences we are having is very interesting and very telling. A little bit too about the mental health amongst again just Black LGBTQ young people, and we're able to separate out lesbian, gay, bisexual, queer youth from transgender, non-binary youth, just to see like what those experiences are. And I wanted to look especially at the last two bars here, young people who have seriously considered suicide. Um, 37% and 58% seriously considering suicide, and attempt for suicide being double for Black trans youth, but still ridiculously high. If you're not familiar with youth suicide statistics, which I assume most of you are not because that's not a common passion area, the general population suicide attempt rate is around 4%. So ridiculously high amongst our young people. And another thing I do want to point out, because it's just hugely important for us to be knowledgeable about and keep our eyes on our young people and work towards ending this, is that we are seeing in the United States about like a 30-year like low, like just like it's been a steady decrease in suicide um amongst youth generally and amongst all ages. But even though we've had that 30-year decline for Black young people and for Black people in general, it's been shooting up. And that's not something that a lot of people are aware of. It's not something a lot of people are cognizant or even care about. But it's hugely important to look at that and do something, because a lot of it is our young people. And I will say for Black youth in particular, when you're looking at suicidality, it's getting younger and younger, especially if you're looking at that age range of 8-year-olds to 12-year-olds who have killed themselves. For Black youth, it is ridiculous. So that is just something that I think we all should be very cognizant of and actively working to end and being able to address that. So all of this was incredibly heavy, and I appreciate you all so much for kind of just sitting with me and hearing and like understanding a little bit about why are things currently in this state. I will say, because I always say this, my background's in public health, but there is something unique about the experience about being a Black person in this country that will make you sicker than any other country in the world. So that is one thing I do want to point out. It is not about who we are as Black people. It's not about who we are as transgender people. It's literally, what is it about this country that makes us so sick? And that should be our question. I'm not here to debate people about their identities and things like that, but knowing like, what is this experience? Like, this is the shared experience that we are having to have much poorer health outcomes. And despite that, I did want to, and I have more of my presentation, but I did want to shift to the hope, where we can move from here. And I use hope often, one, because we are designed for survival, and I mean that in like a biological sense. We are literally designed for survival. We are designed to overcome and um to thrive, even despite the situation that we are currently in, despite the world that we are in. We can make it different. And I tend to use hope much more than the term resilience. Personally, I hope I never have to hear the term resilience ever again, just because so many people use it as a way to kind of wash their hands of their participation and their benefit from Black suffering in particular. But also, it makes me think of people who praise the phoenix for rising from the ashes and like, oh, it's so beautiful, so lovely. But it's like, did you ever stop to ask why the phoenix had to burn in the first place? And that's where I kind of want to shift back to, what can we do? What are some tangible things that we can walk away from this presentation and work towards? So, for healthcare providers, if you're in the space, if you know them, if you have the opportunity to train them and teach them, there are several things that we can do. Uh, we can have robust non-discrimination laws. We can have targeted funding to support uh, Black transgender health. And we can also include in practice policies that are affirming, inclusive, and culturally competent throughout the US healthcare system. Also, a lot of the training that I do provide actually is for medical students, is for young residents, but that doesn't get at the providers who, say they've graduated medical school 10 years ago. Those people still could use this support, could use some training, just so that they're better able to serve all of us. And one really cool health intervention, there's several, but this one was really neat. That nothing about us without us is at the forefront here. And this is called TWIST, Transgender Women Involved in Strategies for Transformation. And it is an intervention specifically by transgender women for transgender women to reduce STIs and HIV transmission. So I'm really excited about that. There are several other initiatives like this, and this is a CDC initiative, by the way. Sorry, I didn't lead with that. I made it seem like it was very grassroots, and it could have been that way in origin, but it's a CDC project. And there are a few other CDC projects that are specific to improving Black health, because all of this is interconnected. Child and maternal health is connected to Black transgender health because they are connected through the framework of reproductive justice. Our children deserve to grow up to, be live lives free from harm and violence, intimidation, and we should be able to decide whether or not we become parents and how we become parents as well. So um, all of our um, all of our experiences are definitely interconnected for sure. Some other things that we can do, in particular, when thinking about allied communities, we can, first thing you can really do to be helpful is to have a personal connection to someone who is transgender. There are so many people in the world who are like, I don't know a single transgender person, and you are going to have much more care. You're going to operate differently when there is someone you can think of, whether it's a friend, a family member who has that experience. You fight a bit harder for them, and that's for anything. People who really care about, say, something like cystic fibrosis, they care about that because there's someone, a loved one, who's experienced that. And, again, having that personal connection is hugely important. And it does so much more than just kind of like imagining people existing. So another thing that we can do, which we're doing a little bit here, participating in transgender inclusive training led by people of trans experience. I do that, like I said, for a living through Healing Wellness, but there are other organizations as well. Please, access that training. Similar, like if you are looking for trainings for the Black experience, you should want to have facilitators who have a Black experience, not just kind of like, I knew a Black person once. That's not going to be helpful to you. Um, Another thing we can do as allied communities, so allied communities being people who are not transgender or people who are not Black, operate as though you already serve Black transgender and non-binary clients. Because if you serve Black people, you already do. We don't necessarily have to disclose that we're present in order for you to operate as though that we exist and we are present and we matter. Um, Working towards financial freedom and funding for organizations and initiatives led by Black transgender people. Again, you saw with those statistics around poverty and unemployment, a lot of times we aren't able to even fund what what that could look like, that freedom could look like for us. So that would be helpful as well. Fighting for safe and equitable housing for all, training and hiring transgender workers for life-sustaining careers, not just like, a random job, but something where, we can support ourselves, we can support our families, and also prioritizing Black, transgender, and non-binary well-being among youth-serving organizations, mental health professionals, research endeavors, anywhere, any space that you're involved with. You should also be able to advocate for and champion for Black transgender youth. So whether that's, Big Brothers Big Sisters, Boys and Girls Club, YMCA's, like all of those existing entities in your communities, you should be looking to them and making sure that they also are welcoming for all of our young people. Family support things that really excited about as well. This is something that we probably already knew anecdotally, but it's also been evidence backed. When Black families talk to their Black children about, basically instilling positive uh, racial stories and feelings and values in their young people, that helps protect them. That is a protective factor against racism. So very similar to that, Black families should be encouraged to support their transgender and non-binary young people by having overtly supportive messages around gender identity into their existing family structure. Being able to say that helps people to believe it. It's basically a self-fulfilling prophecy. So that's something that we should be supporting families with. And also having the educational resources to help them show up as best as they can for the young LGBTQ young people in their lives. That's also work that I do, which is really exciting, but we're not here for me. Um, Also to make sure that we're including families and friends in any efforts to create and implement intervention strategies for reducing suicide among Black, transgender, and non-binary young people. Like I said, that the suicide rate amongst Black youth is so devastating right now, and we really need everyone to have their eyes on all of our kids, because it is important that they make it to tomorrow. It is important that they grow up into, thriving and healthy adults. Um, Within Black transgender communities, there are some things that we've had several interesting focus groups. I've been looking at some of the qualitative research around, just Black transgender folks, what we want to do, what we want to prioritize. And some of the common themes are safety, acceptance, and support, interconnectedness with each other, with our larger LGBTQ and Black communities, resource sharing, advocacy, collective action, and community potential, and also being able to expand our historical chosen family model. So that's the thing too, is that we are not starting from a deficit. We have a lot of existing strengths in our communities. We have so much history of Black trans people forging alternative kin to survive the twin oppressions of white supremacy and transphobia. Whenever you see things like Paris is Burning or Pose, or if you're familiar with ballroom culture, we've been doing this for hundreds of years, making sure that we look out for each other. We've been creating families. And also, even if you're not familiar with that, in the queer and trans context, Black people have always done this. There's never been a matter of like, well, that's not my biological child, so I'm not going to care for them. I'm not going to raise them. How we've always operated. Our grandmothers have always said, yes, there is another space at this table. Yes, there's another plate of food. I'm going to stretch this pot of soup. And we've always cared for each other. So really leaning into that and, that backbone of our culture, and celebrating that, because we don't have to look outside of our groups in order to find solutions to improving our health. Um, and I do love this quote. I do love sharing this always. If you've come here to help me, you're wasting your time. But if you've come here because your liberation is bound up with mine, then let us work together. This is by Lila Watson, an Indigenous Australian woman. And this is something that I always come back to. So again, I know a lot of these statistics were difficult, to know and to kind of work through how that impacts people. But I also want you all to know and you to take away that there is absolutely something that each of us can do to improve the health and well-being of Black transgender folks. So these are some of the sources that I use. If you would like copies of my slides, you're welcome to have them. But I do have suggested reading. If you haven't read this, it's really good. It's called Black on Both Sides. It's a racial history of trans identity. Literally the very first transgender people in the Americas were Black people. So it is really cool to see that and to see throughout our history where we've been at, and kind of just what that experience has been and how we've paved the way for so many other people to receive recognition and care and concern. And we are still fighting for that on our, for us too.